Namaskar. Hello everyone. This is Dr. Dibyendu Kumar Ray, Senior Consultant and Head Department of Neurosurgery, Manipal Hospital Broadway, Salt Lake, Kolkata. The topic of today's discussion is World Brain Day. In 2025, the World Brain Day is on July 22nd, and the theme for this year's World Brain Day is Brain Health for All Ages. Basically, the theme emphasizes the importance of maintaining proper, healthy brain function throughout all ages from childhood to the older ages. Brain health encompasses the proper functioning of the brain so that a person fully realizes his cognitive, social, and emotional aspects of life throughout his life, from childhood to old age, in the presence or absence of any neurological disorder. It encompasses the proper maintenance of brain function so that a person realizes his full physical, social, and emotional connections and well-being is preserved. There are various myths regarding brain health, like we use only 10% of our brain. That is wrong. Various areas of the brain are connected by fibers and they act as and when required. They are interconnected, and so when one area is not working, it does not mean that that area does not work at all or is not required. A proper functioning of the brain requires almost all areas of the brain. It is to be noted that brain tissue is all permanent cells. Once lost, they do not regenerate in a person's life. There are various stigma associated with neurological disorders, mostly with epilepsy. It is to be noted that epilepsy is not a disease that is transmitted genetically. It is also to be noted that epilepsy is not something that is contagious. Epilepsy can be treated, and treated well, it may go into remission or into good control with proper treatment. It is also to be noted that women with epilepsy are not excluded from childbearing, and there is no relation with proper treatment that the child will be epileptic. Various social stigma often lead to concealment of the disease by the patient and subsequent non-treatment, which tends to increase the burden of disease. We should also realize that social stigma leads to social exclusion, both from peers, friends, and relatives, as also from exclusion from healthcare services. As an educated society, it is incumbent upon us to prevent social stigma for neurological disorders. Social stigma can easily be broken by education and awareness. It can be broken by policy changes. It can also be broken by sensitizing other people and making them more emphatic and empathizing with others. We need to come forward to educate the less educated and empathize with the diseased. This will lead to social inclusion, early diagnosis, better remission and recovery of patients with neurological disorders. Thank you so much for your time and attention. Have a good day. Namaskar.